Hi, I'm Dr.YVRao, plastic surgeon from Hyderabad. Most of the times we talk about, or rather most of the surgeons, they do talk about their best results or good results. Whereas most, they don't like or rather reveal their other part of it, that is not so good or even bad results also. Today is one such case where I have done rhinoplasty, but I was not happy, and patient also was not happy to some extent, but not totally happy. So what we are going to do is redo the surgery again. So what happened is initially he sustained injury somewhere in childhood, for which he underwent somewhere. I could ask if
last time Jaipur.
So he got it done at Jaipur, some rhinoplasty, and then for the deformity and depressed nose, they have placed a silicone implant in the nose, and then they have done rhinoplasty. So he came with the complaint of that displaced the silicone implant. It was a little crooked, and then he wanted to get it corrected also, and he wanted a little narrower nose. So we have replaced that. We have taken out the silicone implant and took conchal cartilages from both the ears, and then shaped it into a dorsal graft and then placed it here. So what happened is that part seems to be fine, and then is corrected and it is straight. But still, what happens is there is a little more width in this region, that is debulking needs to be done here, and we have done an osteotomy also. And he feels this part of the nose is very narrow, and in fact to me also it appears the same thing. We excessively narrowed this part of the nose. That's what I say. We have done a little overdo in this case, a little underdoing in this case. Probably he needs a little graft on the sides, and then debulking or reduction in this zone. Maybe some removal of the extra fibrous tissue also, and then shape this part of the tip, columella suturing properly, and then narrowing this part also, narrowing the bilateral nostrils. So this we are going to do the rhinoplasty today. For this, the graft materials we can take from the costal cartilage, that is from the rib also, or from some other soft tissue also we can place it. For soft tissue, we can even take a little from the temporal fascia. We inject the numbing fluid in this region under local anesthesia, and then take a bit of fascia also, and then you can place it even on the sides.
After seeing that everything on the dorsum and rest of the dorsum or rest of the nose is grafted well, and this is the final stitch that before final closure of the. So this stitch brings, you can appreciate it better if you see it from the side, and this stitch brings down the skin directly onto the tip, so that the tip will be maybe a millimeter or so projected beyond the dorsum. This is called the supratarsal fix. Stop it. Yeah. Got it. Yeah. So now we'll close the wound, and then there is some amount of excess in this. We have to debulk this part also, and then finally I'll close the wound. I have removed a piece of graft, that is cartilage graft from the dorsum. This is the cartilage taken from the ear, part of it, and part of it I'll be using it to define the tip a little more. This I'll place it like this, and then define the tip. I have removed a nostril on the nostril reduction is done. You can see the circumference of the nostril is reduced slightly on the left side, not on the right side, so we are going to do it. This gives us a smooth rounded appearance at the sides. There is something called, if it is inadvertently done, this is something called triangulation without any groove. That's very difficult to treat, and at all possible it should be avoided. It should be always like this. It should never be like this. So now I'll reduce this one in symmetry with the other side.